Hey guys, day 4 with amazing Carrie. Hopefully you've been watching. We've got 1, 2, 3, we're now 4. This is a biggie because you actually get to do a little bit of hands-on. This is where people go, oh my God, I'm a proper owner. I'm a proper owner now. So what we're going to be teaching them today, Carrie?
So today we're going to go to the prom. So let me get into my screen. Okay, so by prom, what I mean is passive range of motion. And range of motion, or you may see it written as ROM, just means the ability of the joint to go through its full movement. So if you sort of take your elbow and touch your fingers to your shoulder, that's full elbow flexion. And then you straighten it out as far as you can go, that's full elbow extension. So to go from that fully straight to that fully bend is the range of motion of the elbow joint. Now, if you were not moving and I took your wrist and moved your wrist to your shoulder and you did not help me at all, that's what we mean by passive range of motion. Passive meaning someone else is doing the movement, not the person who owns the joint. Okay. Right. So in physio, we do range of motion exercises and passive range of motions all the time, especially when you're coming out of a cast or surgery, when everything is really stiff and nothing is moving. So getting your range of motion back is one of the most critical early things to do after surgery, regardless of whether it's a human, an animal, or a rugby player. Okay. So owners can learn to do passive range of motion quite easily. And if you can get them this guide before surgery, they can practice before surgery. And I would practice on the good leg so that you know you're not sort of hurting anything. But if the first time you've actually touched your dog is the day after surgery, that can be a little bit scary.
Yeah.
So
why do we do this? Because a lot of people will be like, I don't understand, what's this got to do with anything? So what happens during a pathological process and surgery?
So we know, so what happens as soon as you do surgery, you open the joint, you do something inside a joint, the joint will swell, right? When a joint, and that's just the normal body's reaction. If everyone, you guys have all had some kind of swelling, you've sprained your ankle, then, the ankle swells up, you tweak your knee, the knee swells up. Swelling is normal after any kind of trauma, and surgery is trauma, okay? So when you have swelling in a joint, it causes pain. When you have pain, you don't move as well. And so all of that swelling and pain starts to create stiffness in the joint. And if you don't get the movement to come back to full, that starts to influence arthritis. So do you see that progression, Hannah, with arthritic joints?
Yeah, definitely. So the rule of thumb with arthritis, it's so simplistic. It's either abnormal forces on normal joints or normal forces on abnormal joints. And in this situation, if you haven't got that normal range of motion, you're going to have abnormal forces going through them. So trying to get that flexibility back is really, really important. And it influences the whole limb, doesn't it? If you've only got a small range of motion possible through that knee, the joints above and below are going to have to work a lot harder to be enable that dog to take the same stride length, to have the same power, but they'll never get that, will they? And I think a lot of people think, well, I've got through the surgery and the wound's healed, and they don't think about returning function. And having that range of motion is going to allow function, and your dog's going to go back to a functional life, which is going to be a good quality of life. But yeah, surgery will cause those tissues to thicken, and they're not going to have that same flexibility. So what Carrie's going to teach you is going to try and keep that flexibility.
Exactly. And the easiest time is right after surgery to start this, because you don't allow things to get stiffer, right? The more you don't use something, if you don't use it, you lose it. I'm sure you've heard that before.
Yes.
Or another good one is motion is lotion. So we want lubrication in the joint. We need these joints to be fluid and moving smoothly. And the best time to start that is day one. Okay.
Yeah.
So we want you to get comfortable doing this though before surgery if you can, because then you're just going to feel so much better handling the more delicate surgical leg if you're already used to handling sort of the normal leg. And even if you haven't had a chance to practice, you certainly, once the dog comes home from surgery, you could still practice on the good leg if they don't mind lying on the surgical leg, right? So make sure I would.
And you can practice on other joints as well. You can, just to get your dog used to the fact that he's being touched and you're doing something quite strange you've never done before. I just need to interject, and you just check this with your surgeon, because there are still a lot of people that are a bit in fear of too much hands-on being around the area. So always talk to the surgeon who's in charge of the case and just say, you know, I'm interested in trying to get my dog's function back as quickly as possible. I've read, I've listened, I've, you know, seen this sort of intervention. Are you okay with me doing it? Because we would hate you to have any kind of backlash. So when you speak to your surgeon, say, you know I'm going to do the rest, I'm going to do the restriction, I'm going to do the support. I'd like to do cool treatments. So it's called cryotherapy. Are you okay with that? I was planning on doing it 3 times a day, 10 to 15 minutes, bag of peas. Carrie Smith told me so. I'd also like to bring in some passive range of motion. You know, the lovely Carrie Smith taught me this as well. I can't see it will do any harm because I'm working within what my dog will allow me. I'm not pushing it beyond an area of discomfort. It's just a natural flexion and extension in a comfortable zone. Are you okay with me doing this? Because we would hate for somebody to lay blame, wouldn't we? So
exactly.
Something that was completely nothing to do with your passive range of motion did happen, and the surgeon would say, well, there you go, you shouldn't have done that. So do be open about these things.
Yeah. And just so that you're aware, this is very normal after this is a normal part of rehab after any surgery. So it's sort of like icing is normal, and so it's not anything that's unusual, and your surgeon would be well aware of the practice of passive range of motion. So it will also depend on how bandaged the dog is, right? Because the bandages will also limit the range. So sometimes you won't be doing as much of this until the bandaging is off. So again, each surgery is a little bit different. Each practice is a little bit different. What I would recommend is if your knee has quite a big bandage on it, you can still work the toes and the HOCK and the hip without even touching the knee. And just working the joints above and below where the surgery was still help pumping and lubrication and blood flow, and it helps the whole leg. In fact, if you do it on the opposite good leg, it still has an effect on the surgical leg. So even if your dog, you can't even touch their sore leg because they're too painful, do it on the good side, because that still helps the body to be moving. Okay.
Yeah, totally agree. And I think always, you know, watch the video very carefully, because sometimes a picture can lead people astray. So a static picture, there is no force being applied here. This is really working within the dog's comfortable range of motion. There shouldn't be resistance to what you're doing. This isn't like a manipulation. You're not like cracking a back. There's no cracking the stifle joint. And so be really, really cognizant of what you're doing, if that makes sense. There's no force here. And if you're not happy, you don't do it.
Don't do it. Yeah. So that's a really good point, Hannah. And there is, when you do this, it should be very easy, and your dog should just be lying there relaxing. There is no, as soon as you feel resistance, you're going to stop. Okay. If the dog is fighting you, you're going to stop. Not all dogs like to be handled very much, right? So if your dog really doesn't like this, don't do it, right? So and maybe do the other leg, right? So there are ways you can work around that, but in a perfect world, what we're really trying to do is regain full range of motion post-operatively, because if that dog doesn't gain back full hip and knee and HOCK, the HOCK being the ankle joint, knee range of motion, they can't sit straight. If they can't sit straight, Then they get into this sloppy sit that we call them. And a lot of the dogs are sloppy sitting even before surgery because they're trying to protect the leg. So if you see your dog can't sit and they kind of go over onto one hip, that's called a sloppy sit, because they have to have full knee bend and full hip bend to be able to get into a normal sit position. Well, if they can't sit straight, that means they can't push up from sitting. That means their back starts to get sore. That means more pressure is going on the remaining good hind leg.
Yeah.
And guess what? That's why ligaments start to tear on the other side, because they start to make all these adaptations that aren't normal. Okay.
Yeah. And I think, as you say, timing is key. Like, using me as an example, since I've gone from being a vet that's up, leaning over, consult room table, bending down to the floor, picking up animals, and I'm now more sedentary in front of the laptop, I am a lot stiffer. And it's the longer I've left it to do something about it, it's going to be harder to reverse that. Whereas if I had been wise and I had been doing lots of yoga and stuff right at the start of my sedentary lifestyle, I would be a lot better person.
Yeah,
I've got a bit of an uphill battle. And I think just learn from that. Get in there, trying to keep flexibility early.
Mm-hmm. Now let's just talk about arthritis for a second, since it's your passion. We know some dogs will already have some arthritic changes happening in their knee since the beginning of this. Let's say you had a partial tear 2 years ago. Well, guess what? There's already a little bit of arthritic change happening. And so by the time they get to surgery, there are dogs that will never get full knee flexion back because they've already had arthritic changes. And so when you go to bend that knee, they won't like it, and it will feel, we call it a hard end feel. It won't feel buttery like your other joints will feel. It'll feel like there's resistance, and it's actually a hard resistance. Do not push into that. That is not going to help their arthritic knee. It will only aggravate their arthritic knee.
Yeah. Play very much in the safe zone. Mm-hmm. Don't go to the dark playground.
Exactly. Okay, so should we go to the video?
Go to the video, and then we're going to leave it there, and we will see you back for the final day tomorrow. So
okay,
the video.
Enjoy the video. We'll see you tomorrow.
Bye.
We'll work on the main joints of the hind leg, which is the hip joint, the knee or the stifle joint, and the HOCK or the ankle joint. Passive range of motion helps joint lubrication right after surgery. Anytime you've had an injury or surgery, the joints will tend to get stiff. They get stiff because of swelling around the joint and lack of use of the joint. So one of our rehab goals is to regain full passive range of motion. Similar to massage, I like to be behind the dog for this treatment. Always support under the knee joint, and obviously the surgical leg needs to be on the top because that's where you're going to have access to it. And don't let it drop down towards the opposite leg or the floor. So we want to keep it in that kind of plane of movement. The first motion we're going to do is called hip flexion. So supporting under the knee and the HOCK, just bring the whole leg up towards the spine, or if you're sitting behind the dog, just bring it towards you. In normal hip flexion, the knee should be able to go sort of above the level of the spine. I like to do 5 repetitions for each of these movements. Our next hip movement is called hip abduction, ABDUCTION, and is in the word abduction, that means to take away. So we're going to take the dog's leg away from the center. So again, supporting under the knee and the ankle, just pull the dog's leg up towards you, getting a good abduction motion there. So just taking it straight up where the knee would be pointing towards the ceiling. Again, I like to do about 5 repetitions. And you can see as I lift Stetson's leg, he's got a little bit of bruising. He's only a few days post-operatively here. And so you can see some of the bruising that's happened because of the surgery. Don't worry if your dog has bruising. We're just not used to seeing bruising on dogs because the fur hides it, but it's quite normal post-op. Our next hip movement is called hip extension. Of all the hip movements, this is the one that may be a little bit tight and sore after surgery. So if your dog resists this, don't force it. So again, you see I'm supporting under the knee and the ankle, and I'm just allowing the leg to kind of push fully back. He actually likes this motion. It's a good stretch for him. And you can also add in a little belly rub, which sort of facilitates hip extension. This motion is stretching the muscle called the psoas, and that's the muscle that can get quite stiff. So this will help get that muscle stretched out as well as get the hip stretched out. Our next joint to work on is the knee itself. We're going to start with knee flexion. So supporting under the leg. Now, if your dog has bandages on, you continue to do this, you just don't take the bandage off. The way we work knee flexion is to take the bone of the ankle towards the bone of the pelvis. So we're trying to approximate those two bones and bend the knee as far as possible. Now, you can see Stetson has full knee flexion here, and he's only a few days post-operatively. And very often dogs will have this back immediately after surgery. Not all dogs, however, will have full knee flexion. So don't force this movement and just go until you feel a bit of a barrier. Our next motion is called knee extension, and it's the exact opposite. We're just trying to straighten the dog's knee here. Now, a dog's knee won't straighten as far as ours will. There's always a little bit of a bend in the knee. So Stetson has full knee extension here. And you can see as I straighten the knee that it's not quite perfectly straight, but in a dog that's full extension. The next joint we're going to work on is the ankle joint or the HOCK joint. And this has two movements. We're going to start with HOCK flexion, and that's where we're going to bring the toes towards the knee. And you can see how that would stretch his gastroc muscle, or the calf muscle at the back of his leg. So toes towards the knee. Now, this is an interesting joint because if we have the knee in a little bit of extension, we don't get as much movement as if we have the knee fully bent. So you can see here with the knee bent, I'm getting a lot more stretch in that calf muscle and in that HOCK joint than if I had the knee straightened out. So for this motion, the angle of the knee is really critical. So bend the knee as far as you can comfortably and then pull the toes up towards the knee to stretch that HOCK joint. When we go the opposite direction into HOCK extension, the knee position is not critical anymore. So as we extend the HOCK, it's like the dog is pointing their toes. So imagine your dog being a little ballerina and just point those toes, and you see how we get that nice stretch in the HOCK joint and a nice pumping action through the lower leg. And this all helps with swelling as well as joint mobility. None of these movements should hurt the dog at all. And if you notice anything getting stiffer throughout the rehab process rather than better, that would be a sign to go and see your vet. Now we want to do a little stretch on the toes. So just pull up from each pad and pull each toe up into extension and then bring all the toes up together. Then we're going to go the same way into toe flexion. So bring each toe down into a flex position and then bring all the toes down together. And that's your passive range of motion of the hip, the knee, the HOCK, and all the toes.